Hi, it's Jenny D and Health Tidbits with Dr. Kohli today. Of course, you've seen her on 9 News as an expert. She also has Cherry Creek Heart in Aurora, her own practice. Still accepting new patients, right?
Yes, sir.
Which is
That's
good.
right. Yeah.
So today we're going to talk about the Hantavirus.
Mhm.
So what can you tell us about this virus? And is it unusual to see it spread from person to person?
So, Jenny, it's really scary that it's in the headlines. And I know so many people have had COVID fatigue that they're scared this is going to be like COVID all over
Mm-hmm.
again. The good news here, it's not a new virus.
Yeah.
It's been around for decades. In fact, it was first identified here in Colorado when they developed pulmonary syndrome back in 1993.
Okay.
And there's different strains of the virus that sort of live in different parts of the world. So here in Colorado, we have the sin nombre virus, which is the strain that just spreads from rodents to humans, not human to human.
Okay.
In South America, they have the Andes virus, and that's the one we're talking about that's causing this outbreak. That spreads from person to person. But that's
Okay.
been around in South America for a while as well. And then in Europe, they actually have a different strain of the virus that causes a slightly different disease. So it's not unusual for it to spread person to person for the Andes virus, but it is unusual for us to see the Andes virus here in North America because it's not usually a strain that we're dealing with up here.
So how did it even get on the ship? Like, because that's really when it started being a huge story. So how did it get on the ship?
Yeah, so initially they thought, okay, perhaps there's rodent infestation on the ship that the rodents may have brought it onto the ship. That didn't turn out to be the case. So the World Health Organization's sort of leading hypothesis is that there was a Dutch couple on the ship that are bird watchers, and they docked at one of these ports in South America and Argentina. They went to a landfill, and landfills tend to attract a lot of birds. And perhaps there were rodents there, rodent droppings there that they interacted with at the landfill. Because a few days after they went to the landfill, which was March 27th, the gentleman, the man in the couple, he ended up feeling ill, and then he died a few days later.
Okay.
So about a week or 10 days after they had initially gone on the landfill. Now, they didn't know they were dealing with Hantavirus, so they didn't even check him. Then his wife got sick as she was transporting his body back to the Netherlands. Obviously, she came into contact with his body, and she was on the plane and everything. And then when she died, that's when they realized they checked her blood and they found the PCR of the Hantavirus, that's what they were dealing with. So they think that that's how it got onto the ship, is potentially from that landfill.
And that's the one that goes person to person.
That's the one that goes person to person. And
Okay.
we used to think that it has to be close, intimate contact, person to person, like sexual contact or sharing spoons and, those types of things. But previous outbreak of the Andes virus has shown us that sometimes even casual contact, and they saw in this previous outbreak that there was an individual who went to a party when he was infected, and he ended up infecting 5 other people at the party. Yeah. Now, what's interesting is not every person who's infected with the Hantavirus spreads it. So there's some super spreaders and some not so spreaders.
So it's so many questions that.
So it's really hard to know.
Yeah.
Are you one of those people that spreads it to a lot of people very efficiently because you give off a lot of virus in your secretions? Or are you one of those people that doesn't spread it efficiently? If you compare it sort of side by side with COVID and flu, it's less contagious, but that's only when you think about public health measures to try to contain it. So
Okay.
it's not airborne in the sense like COVID was. It doesn't sort of spread as easily through the air, but it can very easily spread through those bodily secretions.
So do we have it here in Colorado? Because I heard that a guy in Douglas County, in my county, that he had died from it.
So as far as we know, we do not have Andes virus strain of Hantavirus here in Colorado.
Okay.
As I mentioned, that sin nombre virus has been here for several decades, and that's the one actually we think we have a high concentration of here in Colorado because we have deer mice here.
Yep.
And so it's unclear how this Douglas County gentleman got it, but the Colorado Department of Public Health has told us very clearly that this is the sin nombre virus strain. So it's not the person-to-person spread, it's the
rat to
rodent-to-person
person. Okay.
spread. Yes. So possibly he came into contact with rodent droppings. But I think this is an important message for all Coloradans because, spring is here. We're cleaning our garages. We're cleaning our mountain cabins. And you could have rat droppings or mouse droppings or something else in the corner and just kind of sweep it up. And the way that it spreads from rodents to us is we actually inhale those droppings.
Oh, gosh.
Urine, saliva, or feces that's dried, we inhale it. Of course, if you come into contact with a rodent carcass, like a dead rodent, you pick it up, that could certainly spread it to you as well. So I encourage everyone who's doing any kind of spring cleaning to cover up all the orifices, eyes, nose, mouth, even wear personal protective gear, double glove. And then if you see something in the corner that you think might be rodent droppings, you want to spray it with a bleach solution, at least 10%. Let it sit for like 10 minutes to 30 minutes. And then when you're all covered up, then sweep. If you do end up getting rid of an animal carcass, make sure it's double bagged, make sure it's disposed of properly.
Okay. And what are some of the symptoms of the infection, and like how is it basically some are mild and some are death?
Yeah, so it starts like a flu. So you have
Okay.
muscle aches and pains, like you have a fever. And then in some people, and this is based on, we think, genetic predisposition, because it's kind of how your immune system responds to it. Genetic predisposition for getting the infection, but then also how sick you get with the infection.
Okay.
And so some people end up in the intensive care unit with this particular Andes virus strain because they go into shock. It's called cardiopulmonary or Hantavirus virus syndrome, but it's basically the heart and the lungs kind of give up. So the lungs fill up with fluid. The heart can go into shock, which can affect all your other organs. And unfortunately, there's no treatment and no vaccine really to prevent this. And so we essentially just have to support the organs until the person clears the infection on their own. Now, the European version of the virus can present a little bit differently. That can have more liver involvement.
Okay.
So that's a little bit of a different presentation. But if you do get that pulmonary syndrome, your risk of dying is pretty high. It's 30 to 40%. And
So-
that's what's really scary about
Yeah.
this.
Just knowing, especially without the treatment or the vaccine right now.
That's exactly right.
So you did say something about genetically susceptible to hantavirus. Like, are there specific people that are more likely to get it?
Yeah, we think it's kind of a genetic signature. It's called HLA phenotyping. It's how your immune cells' genetic signature looks that may potentially increase your risk of exposure. Now, certainly how much virus you get exposed to, whether you're elderly or not, whether you have other medical conditions, what medicines you're on, this can all affect it. But what's scary about this virus is that even young people can get very sick. In fact, young people tend to mount a more robust immune response. And it's not the virus itself, but it's the response to the virus that fills your lungs up with the fluid, those inflammatory cells, the infection-fighting cells. The body goes to war on the virus. And that's really what causes the consequences of pulmonary syndrome when you have your lungs fill up with fluid. So I do worry if it starts to spread more prominently here in the U.S. Now, thankfully, whoever's come off that ship, they're being isolated or quarantined if they've already tested positive. So that to me is really reassuring. It does have a really long tail. So it can take like 42 days after exposure for you to start to manifest symptoms.
Oh, goodness.
And a few days before you manifest those symptoms, you can spread it to someone else. So it's going to be really important, and I hope that some of the people on the ship agree to sort of stay those entire 42 days.
Yeah.
Because in France and Spain, they're actually mandating everybody who comes off the ship be isolated or quarantined for the full 42 days.
Just in
to
case.
ensure.
Yep.
Yeah. But here in the U.S., I think we've decided to let people go back if they're not symptomatic and just monitor them. Personally, I don't agree with that.
Yeah.
I think the 42 days would do us good because then you know for sure that they're not.
Well, and you don't want to
potentially
chance
spread.
anyone else's, even if you don't have symptoms, you don't want to chance, possibly killing somebody else with this virus.
That's exactly right, because some people can carry the infection and have minimal symptoms, but then still potentially be spreading it to others.
So make sure you do your research. Make sure you cover up. Double gloves. I like the double gloves anyway. If you're doing that spring cleaning, hantavirus, we're going to be hearing, I'm sure, a lot more about this in the future. So, Dr. Kohli, thank you so much.
Thank you.